there. Yay! Hello, everybody.
Happy Tuesday from Krystyna, Holland of Inclusive Care.
Yes, and Dr. Ashley DeBoer of Rise Chiropractic, right here in the lovely city of Lakewood. I think most people know where we're at. I don't know if this is reaching really far. Maybe they don't know where we're at, right? Suburb of Denver. Go with it, right? Yeah. So it is Tuesday again. I know we skipped last week because of traveling and busyness. Well, I don't know what she was doing last Tuesday. I was here, but she wasn't. I'm just teasing. And so we thought today, we're like, what have we talked about and what have we not talked about yet? And I know we've talked a little bit about just kind of in general, why you would come to see a pelvic floor PT or chiropractic, especially like in kind of the in somewhat of the postpartum period. I'm not trying to be just exclusive to that. But so today we thought we'd talk about like, you don't have to pee yourself, right? And what that means as far as why you're doing it, like what is happening to your body and your anatomy that's causing that. And then why getting adjusted, why getting pelvic floor work would help, and why breathing and some I guess you call those home exercises, I guess. Breath work you can do on your own. Why those help with it. Right? Did I kind of get everything?
Yeah, basically a deep dive into leaking specifically, urinary incontinence, and what you can do about it.
Yeah, perfect. You don't got to pee yourself. I know. I said we are making a shirt that says you don't have to pee yourself. I just got to get on that. Add it to the list, right?
Yeah, well, that'll be creative branding. I currently have a shirt that says support local orgasms, so I'm not going to say I wouldn't wear it.
Yeah, I have a shirt that says my vagina is magical, and I love that shirt, so I would totally wear it too, right? All right, so I'm going to let Dr. Krystyna kind of start us off since there is a lot as a chiropractor that I can do to help, but really if somebody is really struggling with leakage, and I shouldn't say really struggling with leak, like I was going to say like a lot. Well, it's not really like, it shouldn't be measurable, just leakage in general. This is definitely something as a chiropractor I co-manage. So even though I have some tips and tricks and stuff I do on my end, it's definitely something I co-manage. So I'll kind of let you maybe talk about what the heck leakage is. I think most people get it, but just a little bit. And then maybe a little bit of the anatomy or why it's happening.
Yeah. All right. So there are a couple of different types of leakage, right? Or urinary incontinence is the medical term for it. If you are leaking when you laugh, jump, cough, or sneeze, that's stress urinary incontinence. And that's happening because you have, a lot of the time the muscles are too tight. Sometimes you have, or they can also be too weak for the job that you're asking them to do. Some people will have incontinence where they just leak all the time. Maybe they can't feel that they're leaking. Maybe they can't feel that their bladder is full. That often happens to people who maybe have a spinal cord injury, who maybe are older adults, people who have any sort of nerve damage to that area. Those are the people that would be kind of leaking without realizing it, and they are probably wearing some type of pad all the time. Yeah. And then there are people who they may or may not actually be leaking, but when they hear water, they have to pee, and they have to pee right now. When you put your key in the lock, when you come home in the evening, you have to pee, and you have to pee right now. Sometimes people will leak on their way to the bathroom. Sometimes people will make it all the way to the bathroom, but it's like a very urgent situation, and we call that urgency incontinence. Urgency incontinence can also be no fun either. No, it's really not. No, and so that doesn't seem, even if you're somewhere you're triggered and you're like, oh, no bathroom. That's exactly it. So like I see people all the time who are like, oh, well, I'm not ever actually leaking. I don't wear any pads. Like I'm fine, but I'm peeing. I had someone tell me that they pee after like at every television commercial. Wow, that's a lot because there's a lot of television commercials anymore. So she's going to the bathroom like upwards of 20 times a day, and she's also going to the bathroom like 4 or 5 times at night. Yeah, at least. Wow. Yeah. So that is obviously interruptive to your life and can be treated. So those are the types. And the tricky thing about it is because there are different things that can cause it, the treatment for it is different, right? Yeah. So something that could be causing any sort of leakage would be pelvic floor weakness. So that's what we typically see in our postpartum population, where they have been carrying a baby for 10 months and the pelvic floor muscles have been asked to do a really big job, and they just are tired and can't really do it anymore. You push the baby out. You're just tired. Yeah, basically. They're like, nah, peace out. Yeah, exactly, right? I don't think it was that easy, right? They push the baby out, and they maybe really stretched out. So the pelvic floor muscles run around your urethra. And so if they aren't able, if they're not strong, or if they're a little bit wider than normal because of having delivered a baby through one of those holes, then it makes it, it makes it harder for them to contract around and keep you continent. So that would be kind of a weakness issue, strengthening, or Kegels. His name was Kegel. I always say Kegel. It is what it is. That would be kind of the solution for that.
Some dude.
Yeah, some old white man, like everything else.
Yeah, exactly. Right.
So
another conversation.
The other thing that could be causing it is that maybe the muscles aren't actually weak, but they're too tight. So your muscles in your pelvic floor work the same way as your muscles anywhere else in your body. So there's an optimal length tension relationship that they should work at. And if they are tight all the time because of stress, if they're tight because you're afraid you're going to leak, if they're tight because you do a lot of really high level activity and don't necessarily like think about stretching your pelvic floor, so like a lot of some of my CrossFit ladies and gents, actually,
I feel like nobody really thinks about like stretching their pelvic floor.
No,
you know, like in the sense of like, all right, I'm stretching, you know,
yeah,
and really
you can't really foam roll that area. I think that's a different kind of party. Different kind of party.
But well, and it's the same with like you're saying strengthening, right? So we've like been taught a Kegel, but I think a lot of times people don't even know why they may do that.
Right.
You know, like they've just been told to do it. That's like a contraction exercise. You know, so even that too, right? It's just kind of like, I mean, it's kind of an afterthought, that whole area, I kind of feel.
Oh yeah, it's definitely
any kind of like training aspect, right?
Yeah, totally. So, but if the muscles are too tight, so at an optimal length tension relationship, the muscles can contract and relax. And your muscles are made of muscle fibers that really do kind of lay like this and overlap slightly. So if they're sitting at this resting tone that sits like this, they can't contract because there's nowhere for them to go. They've run out of room. But they also can't relax like a Chinese finger trap.
Oh no.
So now they're stuck like this. They're chronically turned on or tonic, and now when you laugh, jump, cough, or sneeze, you have this big increase in intra-abdominal pressure, and your muscles are, again, just tired, and they relax for just a second, and that's when you leak. And so then they'll come back on to go back to their original very tight position, but that was enough time for them to like fatigue out and to have a little bit of urinary leakage.
Yeah. So it's not just because you're leaking. So what she's saying, right? Just because you're leaking does not mean it's weak, and it does not mean that it's too tight, right? It could be a combination because it's a bunch of different muscles, or it could be one or the other. But
and sometimes
would a person be able to, like, so say I'm leaking, and for whatever reason I can't get to somebody to evaluate me or whatnot. Is there a way to tell? Like, is it that I'm too tight or not, you know, or?
Yeah, so the easiest way to tell would be to take a hand mirror and look at your perineum, basically. And when you take a big deep breath, see if it comes down, see if you can make your pelvic floor relax and kind of open up, or, and see if you can do a Kegel and if it'll tighten. You can also insert your finger into if you have a vagina, insert into your vagina and see if it's really tight. If someone during sex has ever told you like, oh, it's really tight, that could be a compliment. It's often meant as a compliment, but it could be something else. It just depends.
So it would mean that they're too tight. Exactly.
Yeah, it could be.
And then, so if you don't have normal motion, does that indicate that it's too tight or not tight enough? Okay.
Probably. It would be like if you walk around with your bicep and you could only straighten it to like here.
Yeah.
Right?
Yeah.
So you're going to be pretty strong in this position maybe, but you're not going to be strong in this position or this position.
Yeah. Yeah. So maybe you might be able to tell on your own if it's too tight, but weak maybe like there's not as something as definitive. Yeah. Because I guess that would be maybe strength of like if you put a finger in and you try to contract or whatnot, but that to a lay person would probably, you know, like,
it's just hard to be able to tell.
Right? Like unless you know what normal tone is, right? Like of how that feels and whatnot. But so basically what I'm trying to say is that if you're having it, you should have some sort of evaluation. Yeah. And obviously if you're in some location where you just don't have that you can reach out to somebody to at least, you know, talk to them via Skype.
You can do a lot of
whatever,
stuff. A lot of that stuff you could probably do via telehealth, for example. I would just have to walk you through how to do it. Yeah. But the thing is that the treatment for incontinence actually doesn't normally take that long if it's just incontinence. If it's incontinence and pain, and let me specify that. If it's incontinence after menopause, sometimes it can take longer. But if it's postpartum incontinence, it doesn't normally take that long to treat. It's kind of just reconnecting your brain to your pelvic floor, but it's hard to know how to do it by yourself.
Oh yeah.
You sort of need like an external check to like a form check basically. From
YouTube videos may not be very helpful. For
not super helpful.
You know, like, well, everybody's very different, you know, like we said, there's, you know, all different kinds of incontinence. And then there's also like, are you too tight? Are you too loose? You know, like that's just like somebody needs to tell you that to help you.
Yeah.
You know? That's kind of the basis of why you would have it or whatnot, and kind of the anatomy a little bit. So what would your treatment look like?
Yeah. So depending on the problem, right? So it would be the evaluation first, but then if it's weakness, it would be Kegels, and it would be Kegels in different standing is kind of the progression, as well as working a lot with your breath to try and get your entire core system to be on board. So your core is like a cylinder. You say like a coffee can, right?
Mm-hmm. Yeah.
The front is your abdominals, especially your deep layer of abdominals, which is your transverse abdominis. The back is your back muscles, your diaphragm, which is your main muscle of breathing, and the bottom is your pelvic floor. So when you take a big deep breath in, your diaphragm should come down, your pelvic floor should come down, and your abdominals should expand. And then when you exhale, everything should come back in, abdominals should come in, diaphragm should come up, pelvic floor should come up. And so I will often, especially if people are having a hard time getting their pelvic floor to turn on, I will have them kind of try and work that whole system together. Trying to blow out like you're blowing out birthday candles can help to get the TA turned on, which helps to get your pelvic floor turned on as well.
Right. That's what we start with in all of my postpartum rehab classes, all my birth fit postpartum classes is breath.
Mm-hmm.
That's the start. And then there are specific movements that are based off of developmental movement patterns that we do to activate those while being able to breathe properly through them. But yeah, it's just, that's the first key, right? Because especially in pregnancy, a lot of times you kind of get that disconnect because you're just breathing to survive, I say, you know, because you can still do a good, true, like full diaphragmatic breath when you're pregnant, even though there's a baby in there. Just a lot of people don't, or don't consciously think of it. I shouldn't say that they don't, because some still do. They just don't consciously think of it. So her explanation is really, really great. I love in person because I can touch and feel and cue, and it's much easier. And a lot of times it's just simply like, breathe out into here, and like people be like, what, how? And then they do it, and then they understand. Yeah. You know, so that's why I highly recommend, if you can get to some sort of group rehab class, whether it's with birth fit or there's a ton of other ones, I think those are great. It just, some sort of rehab is great, or doing it one-on-one is obviously even better. Just sometimes that's not an option for everybody.
No, and I think that's a great way to like start, especially if it's slow. I just, you know, my concern always is just making sure that it's appropriate for the person who's doing it. But I think those classes can be awesome, especially in like the beginning stages of trying to get back into things like slowly and like with intention. Right. And then because some of the things that I see postpartum, people who are leaking, it will get better on its own. But I also see a lot of people who leaked immediately postpartum or leaked during pregnancy, and then it got a little bit better, but then something else happened later on, or a menopause is a big one, that then we were kind of dealing with the issue all over again. Right. So, and the other thing is that if you're doing something and you don't actually pee, but you really feel like you have to pee, that's still a sign to me that you're not managing something properly, and we need to work on that ahead of time instead of on the back end. Because it takes way longer to fix it if you really wait, as opposed to teaching you the right way.
I feel like that's all we talk about, right? It's like all I talk about, like, oh, or like, I love it when my patients are like, oh, I wish I would have known earlier. You're like, yeah, I know, I wish you would have known earlier too, but it just takes a little bit longer, you know, everything like that. But yeah, I think I always recommend postpartumly that you at least visit a pelvic floor PT. I mean, there's no hurt in it, that's for sure, you know.
Just gives you more information.
Yeah, exactly. And then they can, you know, explain to you for your body what is going on and what treatment might look like and stuff like that too. Yeah. Obviously, I'm a chiropractor, so I adjust. When it comes to the pelvic floor muscles, as much as I do rehab work and stuff like that, all of mine is external rehab work. So it's breath and movement to help reestablish just core strength in general. So like Dr. Krystyna was saying, obviously, that's why I say co-manage a lot, because sometimes the symptoms will get better with just that movement, but I still like people to see what the heck is really going on, because my class is only 4 weeks long. And then sometimes I continue to see people on the chiropractic side, and sometimes I don't. So I don't get that check-in. But the class is really meant to, you know, reestablish the core stability and how to move so you don't hurt yourself with lifting and stuff like that, and then to return to normal, whatever you like to do for exercise or whatnot. But as a chiropractor, adjusting especially the pelvis is really good for your pelvic floor muscles, because what are the pelvic floor muscles attached to? Your pelvis, right? So in the hole is where our pelvic floor muscles would be. So for me, what I analyze when people are having any kind of pelvic floor issues, and I shouldn't just say that, I analyze the pelvis for everybody because it is a big stabilizing factor in your spine, right? So I'm looking at pubic bones, I'm looking at coccyx, because a lot of things attached to this nice little, mine's really movable. It needs some stability work here. So a lot of muscles attached to this tiny little thing, and a lot of people have injured it.
Yeah.
Falling on ice, or just falling in general. And then obviously all the other structures of the pelvis and the spine, all just kind of corresponds and works together. So getting the pelvis back into proper alignment, the spine into proper alignment, helps to balance the muscles. But also needs some hands-on work too.
Yeah.
Which I don't do. So I have her.
So weird. I was talking to someone today, and they're like, I feel like everything we do in your office like is sort of weird, but I always feel better when I leave. I'm like, that's my tagline. Sort of weird, but you will feel better. So, you know, here we are.
Well, yeah, you know, right? And I think it's like, what are you dealing with? Sometimes, I mean, our society, unfortunately, a lot of the things that you would probably go to see you for are stuff that you don't really talk about, you know, and stuff like that. So that's the first obstacle, right? And then it sometimes does involve an internal exam, which postpartumly, once you've had a baby, it's kind of whatever, you know, but it's still like, you know, it's still kind of a weird thing and stuff like that.
I always office stuff out, but a lot of the time people are like, well, you're going to look at it anyway. Like,
yeah.
It's, and especially
like to
like
undress.
everyone has seen it.
Yeah, especially if they delivered like in a teaching hospital. It's
They're like, you're just really like, come on in, we're fine.
Right, exactly. I know, right? It is what it is. It's normal anatomy. I mean, we've just become so like, you know, about it and stuff like that. But yeah, if I think that's kind of the gist. Obviously, like we always say, if you're struggling with anything we're talking about, you can always reach out to us and we can guide you to a good referral or whatnot if we're not local to you. And if you have any questions, by all means, you can comment on any of the videos. We're live on a bunch of different things.
Or if you have anything you want to listen to us talk about, let us know.
Yes, we're waiting for some good ideas because we're kind of like, what should we talk about today? We'll still keep coming up with stuff because we have two brains that are very large.
Maybe pushing it a little bit.
No. All right, you guys. So we will be back next Tuesday, right?
Yes.
Yes. So next Tuesday, we will be back with another topic. We'll try to get ahead of it a little bit, post what we're going to talk about. So especially if it's something that interests you, you can make sure you tune in live or catch a replay, or you can share it with somebody that you know might really need to hear the information too. All right. Yep. All right, you guys. Have a good Tuesday. Bye. Mom.